with me today, I have a very wonderful panel.
As Health Minister, I've used my platform to advocate for both policy and structural changes that center student well-being and welfare. I've worked to expand access to mental health resources by pushing increased funding for school health programs. Like usually we hold medical camps and they are free of charge.
I had to make sure not only being a leader, a student leader in the political line, I first make these students my friends. Make them friends. Let them be free to associate with you. Let them be open to tell you their concerns so that you can be able to raise them now to the university administration, the university leadership, so that you can know what really students are passing through, what is on the ground.
I would want you to tell us, how have these young people helped you guys who are in leadership? How have you helped shift the mindset of people around issues of gender-based violence, HIV and everything?
Most young people really lack the policy language. So even when you bring them on board, they are left behind and the decisions they make are not considered. So how can we build that? I think we should look at capacity building. When I talk about capacity building, let's not have workshops of one day and mentor these. No, let's have a continuous process of we are mentoring the youth.
I've been at many conferences, they say that they are for young people, but the young people seem to become the audience. And for us to believe that these conferences, the service providers, Uganda Commission, SRHR, Uganda Cares, we need now to change the narrative. Instead of us now bringing the conference to the young people, let the young people organize these things for themselves. Let us become the audience. Let's change the narrative of making the young people audience to discuss for them things that matter. Let them discuss things that matter to us.
The challenges of young people, what we see more as Minister of Education is that you have so many sources of information, and so you end up confused. There's social media for you, there's mainstream media for you, civil society is there, peers are there, radio and TV, everybody is there to give you information, and you end up confused. But we always caution that you try to pick out what you think is important.
Stigma has really been a very big barrier in achieving HIV sustainable goals, and of course as the UNAIDS strategy, which is the ending AIDS by 2030, and also the 95-95 strategy, we see that stigma has been a very high burden and a limitation to achieving all those goals. And I can tell you that just like the previous speaker has said, he said that it's actually the stigma that is killing us, people living with HIV. It's not even the AIDS nowadays, but the stigma that people put onto us. Because if I feel not loved, if I feel not appreciated, if I feel not owned by the society, I'll not be encouraged myself to take the medication unless I decide, just like I decided, that stigma will not affect me.
I can really say to young people, a very big congratulations to you all. You have made it. You have really made it, and great appreciation goes to Own Your Future and Uganda National Students Association, who have really shaped this. A very big round of applause to them. Our guest of honor, the team, the young people, have shown us that they need the safe space to speak, to bring out their conversations. And this really was one of the best spaces where they got an opportunity to express their needs, but more importantly, to show their capacity that they can. All that they need is the safe space. They also pointed out concerns of them believing in themselves. One thing I liked about themselves, they were giving peer support to each other. Because what drives us behind is not believing in ourselves. Body image is one of the challenges. You first look at the university you are coming from, the region you are coming from, and you don't believe in yourself and you don't trust in yourself. I think own your future, even that word itself and the abbreviation is enough to show you that own your future, you have the potential, you have the capacity, and you can make it.
Your future depends on one, the first decisions you make that you go to school. You're not to school to pass time. Somebody has paid. So it's the only opportunity you have to invest and have an output as your colleagues graduate. Number two, there are many decisions you make as you interact with your colleagues. Maybe the problems of your colleagues or your problems, your friends may be the problems to what you come out to be. So this is a very precious time, and I want to thank all the organizers. The package from Ministry of Health is that we have to design with you. Whatever programming we are going to do, we really seek your input and we want to design everything for you. You know this slogan which says, nothing for us without us. Okay? If we don't invite you to the table, come chair. Knock on the door, you are very strong voices, and we'll be able to listen. And finally, I want all these debaters to join politics in one time, because I think you'll improve and up the game of quality debates that we shall see in the House, including the level of research that you've done.